So today we are going to learn a fracture. What is a fracture? A fracture, which is a fancy term for a break in a bone, can happen in many ways. They can be classified based on how severe they are, the shape or position of the break, or even named after the doctor who first identified them. Sometimes a bone might fracture without even showing an obvious break. One special type of fracture is called a stress fracture. This isn't your typical bone break. It's actually a series of tiny cracks that can form from repeated strenuous activities like running, jumping, or dancing. A stress fracture can be quite painful and are sometimes linked to conditions like osteoporosis, which weakens bones. Fun fact: about 20% of stress fractures occur in the tibia, the bone in your lower leg. Phases of phases of bone repair. When a bone breaks, your body has a pretty amazing repair process to fix it. There are three main phases. First phase is a reactive phase, second phase, reparative phase, and third is bone remodeling. In first phase, reactive phase, this is the first response to the injury and involves inflammation. When bone breaks, blood vessels around the fracture site are also broken. Blood leaks out and forms a clot known as a fracture hematoma. This usually happens within 6 to 8 hours after the injury. Since blood circulation stops at the fracture site, some bone cells die, leading to swelling and inflammation. Your body sends in special cells called phagocytes to clean up the dead or damaged tissues. This phase can last several weeks. Reparative phase. This phase has two parts: fibrocartilaginous callus formation, bony callus formation. In fibrocartilaginous callus formation, new blood vessels grow into the fracture site, and cells called fibroblasts produce collagen fibers. Chondroblasts start making cartilage, forming a soft callus that bridges the broken ends of the bone. This process takes about 3 weeks. Bony callus formation, closer to healthy bone tissue, special cells called osteoblasts start creating spongy bone. This replaces the soft callus with a hard bony callus for 3 to 4 months. Now let's look into the bone remodeling. In this final phase, the bony callus is remodeled to form a new strong bone structure. Osteoclasts, which are cells that break down bone tissues, help remove the dead bone fragments. Compact bone replaces spongy bone around the fracture site. Over time, the fracture line becomes undetectable on an X-ray, although a thickened area might remain as evidence of the healed fracture. Healing takes time. Even though bones have a good blood supply, healing can still take months. The new bone gradually gets stronger as calcium and phosphorus are deposited into it. Bone cells grow and reproduce slowly, which also contributes to the long healing time, especially for severe fractures. In summary, our bones are incredibly resilient and have a well orchestrated repair process that kicks into action when we experience a fracture, from the initial inflammatory response to the formation of a soft callus and finally to the remodeling phase. Our bodies work tirelessly to heal and strengthen the broken bone. So, next time you hear about bone fracture, you will know just how amazing and complex the healing process truly is.